The week before, three teenagers were transported to the hospital from a house in Burke from suspected overdoses. They go to three different Fairfax County high schools. Not a week goes by that I do not get multiple emails of overdoses throughout the community. This crisis is not confined to any specific community. It's not just in our bad neighborhoods. It's throughout Fairfax, it's throughout Virginia, and throughout our nation. I'm going to share some of my thoughts later on what I think we need to be doing, like putting drug counselors back in our schools. But for now, I want to leave you with just three things. Over 70% of heroin users start with prescription drugs. Please keep an eye on your loved ones, especially post-surgery or injury. Get prescriptions out of your medicine cabinets. Your kids can take them to school and sell them and get real money. Second, you can get help for yourself or a loved one. You're going to hear tonight from the CSB on how to do that. And third, addiction is a disease. And we need to address it as a disease and to work on eliminating the stigma of addiction. Before I get started with the program tonight, we've got a busy program, so I want to move fairly quickly, but I want to recognize Supervisor Dan Stork and Supervisor Kathy Smith, my colleagues on the board, and you're going to hear from our Chairman, Sharon Bull, a little later. So let's go ahead and get started with the program. First off, some brief remarks from Congressman Barbara Comstock, who's been a real leader in addressing this crisis. Last April, Congressman Comstock created the Heroin Operations Team in conjunction with Fairfax County, Loudoun County, the City of Leesburg, and Virginia State Police, the DEA, and FBI. She also hosted a similar town hall like to this one in Loudoun. A few weeks ago, I had an opportunity to go for a ride-along with our street crime units with Barbara to get a first-hand look at the issue that our police face every day. Barbara's keenly aware that we can't arrest our way out of this situation, and she's been a real leader in addressing this issue. Barbara.
Good evening, and thank you for being here to address this very important community health problem. A few weeks ago, I stood with the Speaker of the House, Paul Ryan, and one of our speakers here tonight, Nick Yaku, who lives in Great Falls, and actually was in high school when my daughter was there. Nick is a success story of someone who battled addiction since he was a very young man, and he will tell you his story, and he now is helping others. And that is a wonderful story, and I can tell you Congress was very taken, our leadership was very taken with his story and how we need to help people and understand that this problem is everywhere. About a year ago, I was in Richmond visiting a friend of my son's who was battling addiction, and he was in a recovery, he was in a rehab facility, and talking to him about how this had happened and how his story about how this had come to be. And like Pat, over the past few years, I've seen this throughout our community. In 2014, we had hearings when I was still in the House of Delegates before I was elected in Congress, and we saw people out in Winchester who we saw the problem there, and it started traveling out west. 728 deaths in Virginia, which is more than car accidents now. The use of heroin has doubled, but the deaths have quadrupled because the purity of the heroin that's out there now is so dangerous. So we know we need to attack this problem on all fronts, and that's why we understand it's a community of support effort. We need to have more treatment facilities and more treatment available. We need to have education that both alerts us to the problem that's in our community and to understand and identify it, but also education on how to prevent this and make sure kids understand how dangerous this is, as well as adults, because adults can get addicted. You have a back injury, you get addicted to opioids, and then before you know it, somebody is there offering you a pill that is cheaper on the street now to buy heroin than to buy prescription drugs. But we also need that whole community of support. So we're working throughout Northern Virginia. We have the DEA Museum, I'd like to let everyone know, in Leesburg. It's a traveling museum that is now there for parents and kids to go and learn about addiction and the problems we have and what we can do there. I visited the hospitals, our local hospitals out in Winchester. We have a NICU where you see the youngest victims, babies born addicted because their mothers were addicted. And so now our hospitals are working to find ways, first to get mothers who are addicted off heroin so the babies aren't born with such severe problems. We've met with family after family. We want those families to be able to come out of the shadows and understand that there are others like them and that there is a community of support for them. And if they've kind of gotten to their wits' ends, because anyone who's had to deal with addiction and with family members with addiction, it's a challenge, and one person alone can't deal with that. So we want to make sure those families have support too. And I'm just thrilled that we were able to be here today and respond as a community on the federal, state, and local level. So thank you, Pat, for your leadership and for the work that you're doing with the local police and that ride along. We saw the sacrifices that our local police make to get these drugs out of our community. And I know Fairfax and Loudoun, these areas are very aggressive on that front. So I appreciate your leadership and having this meeting here tonight, and look forward to discussing this further with everyone tonight. Thank you.
And thank you for your leadership in keeping this issue in front of Congress. Next up is Delegate Tim Hugo. I'd like to thank Delegate Hugo for his efforts at the General Assembly to combat this crisis. There was a lot of activity in this year's session, and there's more to come. So, Tim.
Supervisor Harry, thank you for all your work on this. Chairman Golda, thank you for both of you opening up the Fairfax County Government Center for us to talk about this important issue. I think one of the things that struck me is that we live in Fairfax and nobody thinks this happens. You know, I got involved in this because I started working on human trafficking, which again, I didn't think happened here in Fairfax. I didn't think happened in Northern Virginia. And what we found a lot of times with human trafficking, it was an outgrowth of drug abuse and heroin abuse. And this thing is, we look and you think it doesn't happen to your family. What's happening? We have it in Supervisor Smith, we have it in Westfield, we have it in Robinson High, we have it in Centerville, and it's our friends. It's people that are our family members, cousins that we know, and you just don't expect it. And what we figured out working with Supervisor Harity and part of Comstock and others, that it really is going to take a joint level, a joint effort of the federal, state level. This year on the state level, we did a number of things because we did recognize it. Maybe we started out a little late on this in the last few years, but we did recognize this is a problem. It's not something that just happened in the 1960s, which is what somebody said, oh, heroin is a problem in the 60s. What's a problem today? And so this year, we worked this on there are a number of things. We put drug courts in, put additional money in for drug courts. We've made sure that these courts, which are special courts for some of these, many times kids, to say you're not necessarily a convict, should be a felon, not necessarily should be considered a truant. You really are a kid that's got a problem. You're somebody that's a problem, and we're going to recognize you within the judicial system as somebody with a special problem. We're also, too, working on things to make sure that insurance companies continue to treat this and look at the preventive medicines that can help these. And this is something that's incredibly important as we go through this. So we're going to continue to work on this. We're going to make sure that we have the prescribers checked. One of the things we talked to the hospitals on, and we're working with the hospital association, is to make sure that we're checking, because sometimes what we have are these hospital hoppers. They go from one hospital to another, trying to find heroin or opiate or Oxycontin. I think this today, and I want to thank Supervisor Harry for this, this today, though, is probably the most important thing, because we can pass all the legislation that's necessary, but if people at home, people out here in the audience, thank you for coming, don't know what's happening, don't think it's happening, and don't recognize it's happening, it will continue to happen in our neighborhoods. So thank you for being here tonight. Supervisor Harry, thank you for your leadership on this. Chairman Bola, Congressman Comstock, thank you so much.
Thank you, Tim. Next up is Sharon Bulova, the chairman of the Fairfax County Board of Supervisors. Sharon was very supportive of setting up the county task force and has been a leader in establishment of our Diversion First program, which in certain situations gives addicts the option of treatment for their disease instead of incarceration. Sharon?
Thank you so much, and let me first start by thanking Supervisor Harity for convening this forum and for providing this opportunity for us to focus on what is truly a tremendously serious epidemic here in Fairfax County, but not just in Fairfax County, this is a national issue. Almost every day, members of the Board of Supervisors receive emails from public safety, from fire and rescue, from the police department, letting us know of the latest incident where they have responded to, and usually it's a young person who has been found unconscious or very ill, and it turns out to be heroin overdose. It astounds me that we are seeing so much of this every day. I have a little bit of information and statistics that I'd like to use to sort of set the stage. Let me first start out by saying it's important that we are focusing not just on the drug, it's important that we focus on heroin and prescription opioids, but it's important that we focus on the individual, the user. This is a situation where people have addiction issues, and it's important that we focus on that. In the past, there have been other drugs, that have risen to our attention. Crack cocaine, other issues, but right now it is heroin, and it's opioids, prescription drugs, and especially heroin is inexpensive, and so it's accessible for our young people. According to the CDC, there is one opioid death every 19 minutes across the United States. And every day, 44 people in the United States die from overdose of prescription painkillers. Between 2012 and 2014, there were 141 deaths related to opioids, compared to 79 from car crashes in Fairfax County. In Fairfax County, there was a 22% increase between 2011 and 2014 in the number of people who needed services for the use of heroin, non-prescription methadone, and/or other opiates. Fairfax Fire and Rescue reported to 291 suspected heroin overdoses between 2011 and 2014. Use of prescription opioids such as morphine and oxycodone and heroin have resulted in 268 fatal heroin and/or prescription opioid overdoses in Fairfax County from 2007 to mid-September 2014, most of them since 2012. The National Institute of Drug Abuse, or NIDA, reports that every dollar invested in addiction treatment programs yields a return of $4 to $7 in reduced drug-related crime, criminal justice costs, and theft. When savings related to health care are included, total savings can exceed costs by a ratio of 12.1. The 2013-14 Fairfax County Youth Behavior Survey of 8th, 10th, and 12th graders revealed that almost 3,000 respondents used painkillers without a doctor's note, and approximately 300 responders used heroin. That is alarming. So what are we doing? First of all, I appreciate having this summit, this forum here today. The CSB and our public safety partners are battling the increase in heroin and opioid dependence along with the rest of the state and the nation. Detoxification is often the necessary first step towards recovery for a person who is physically dependent on alcohol or other drugs. Ongoing data indicate that often the most successful way to treat opioid dependency and sustain recovery is to combine the use of medication-assisted treatment with behavioral therapies, but without Medicaid and without sufficient funding, people wait. The average monthly wait time, and waiting is not okay, in 2015 was 13 days for medical detoxification These are people wanting help and needing detox and having to wait 13 days, 17 days for social detox, and 20 days for Suboxone, and some people go to jail instead. On average, more than 50 people wait every month for treatment. Mostly, this is a human problem, and people who are addicted to drugs and who are using prescription drugs improperly and heroin, they're risking their lives and they're damaging their own lives and their own potential. We need to make sure that we're coming together as a community to help address this terrible, terrible problem, this epidemic of heroin use. So thank you again for coming and participating, and I look forward to hearing your questions. Thank you.
Thank you, Sharon. Next up is Special Agent Carl Calder to give us a look at the problem from a national level and to talk a little bit about their traveling museum in Leesburg. We're also joined by Special Agent in Charge Scott Hornke. Got to know Special Agents Calder and Hornke last fall when I spent 7 Wednesday evenings at their Citizens Academy learning about the problems in DEA's enforcement and prevention efforts. Special Agent in Charge Calder heads the DEA Washington Division, which covers Maryland, West Virginia, and the District of Columbia. Well,
good evening. It's quiet. Good evening. Okay, now let's go on. Generally, I start this off by showing a nice video to get you warmed up. One of those videos that shows you what the first responders deal with every day in handling this problem. Well, I don't have that today, but Congresswoman Comstock failed to mention that she spent probably about a week or so in the jungles of Colombia seeing how drugs are cultivated. And that is an experience in itself. And that's what we're dealing with at a federal level. The importation and the drugs that are coming from abroad. And generally, we're talking about heroin, Mexico, and South America. The flow of heroin into the country, it's not like it used to be. It's not the movies you saw in the 70s or the 80s. Today, heroin is produced in Mexico and South America. Most of the heroin that comes into the United States comes through Mexico. And you can see from the arrows in the slide where those the destined cities that the heroin is going to. And they're coming from Mexico into our cities on the East Coast predominantly. And you can see that the map, the coloration in red is where we're seeing most of the heroin. And you're right in the center of it. On a regional scale, I've been talking to news stations. I've been doing reports for the last year or so on the heroin highway. This heroin highway is where the transportation into Virginia, Maryland, West Virginia, and parts of Pennsylvania and Ohio. Highway 70 and Highway 81. Highway 70 intersects Highway 81 at Maryland, and that's where all the traffic is coming in from Mexico through street gangs leading into our area. And that's what the heroin highway is. And that's just part of it. We're not even talking about Highway 95, which is huge, which goes all the way up to Massachusetts and New England, all the way down to Florida. Now, Highway 80 extends through Maryland all the way down to Tennessee. And of course, you don't have to go through Washington, D.C. to use Highway 80. DEA initiatives. 2 years ago, we found out there was a huge problem in the Winchester-Shenandoah Valley. And what we did was we started several initiatives, one in Baltimore and one in Winchester. Just from meetings like this, we established programs and initiatives. And you'll see that today when you see all the prevention, treatment, and law enforcement here to discuss this problem. That's where it starts. It starts together. We can't arrest our way out of this problem, but it's no excuse to tackle the problem. So we started initiatives in Baltimore, Trojan Horse, and the Winchester model in Winchester. These were initiatives to team up with community groups, teaming up with treatment professionals and the medical community to fight this problem in a joint manner. And from that Trojan Horse, we were able to get data, significant data from our state and local counterparts to dump into database systems to track different trends and to link investigations throughout the country. And that was the significant part, because at the local level, we can always make the arrest, but it's what you do after making that arrest that makes the difference. To really try to deal with the person that's responsible for bringing in those drugs to your community. That's what that is all about. So we found that through that, we had to start training our state and locals. We have to start training our medical practitioners, our pharmacists. 2 weeks ago, we had a PDAC conference, which is a prescription drug awareness conference, where we had 500 pharmacists participate in that program. And after that program, they were able to see what we have to deal with as law enforcement professionals. And from that, we were able to educate them on how to deal with the overprescribing and how to contact us. And so in November, we'll be having another PDAC conference in Arlington for Northern Virginia and Washington, D.C. So that's part of this whole strategy, is to train our pharmacists, and the next phase is to train doctors. Because doctors, what we come to find out is the fact that they're trained to treat pain. They're not really understanding about this overdose problem. And so we have to train them, and we have to show them what we're dealing with in the communities. And if you really want to see a big picture of this, since 2013, my division has handed down civil penalties in excess of $400 million for big-time pharma for violations. That's huge, and I'm just talking about one division, and that's my division. And there's 21 other divisions in DEA. So you just imagine, if they could use that money for a different purpose, we would be a little bit better in this ballgame. So what we're seeing at a national level is the heroin is now being laced with fentanyl, right? 2.5 milligrams of that fentanyl can kill you. 2.5 milligrams, which is actually a residue that can kill you. That's why this is so dangerous. And what we're seeing is this is not the fentanyl used for hospice care, which is basically medically prescribed. This is clandestinely made fentanyl, acetyl, butyrol fentanyl, which is produced in Mexico. And the chemicals are shipped from China into Mexico for its production. These chemicals can also be purchased and found on the internet. The internet is the most dangerous weapon that we face every day because you can find anything, you can buy anything on the internet. That's why this is so dangerous. And we're talking about chemicals now, compounds. We're finding new compounds being made, new synthetic opioids being made or produced. And with that, it's just like the synthetic drugs. You change the molecules on the compound so that law enforcement can't detect or prosecute. So this is why this is so dangerous. And we have to be aware, and I even have to go out and talk to our state and local partners because they're the first responders. If they inhale it, they'll fall. It's transdural. If they touch it, they'll fall. They can't even field test it. They're taking a risk if they even field test it. So I wanted to come here. I want to thank you for inviting me. I know I have there'll be plenty of questions. We have a booth upstairs with literature. Our traveling museum was mentioned. And I could actually stay here all day, but I'm going to leave you with a few points here. Number one, 4 out of every 5 recent heroin initiates use prescription opiates non-medically. Number 2, heroin overdose deaths have more than doubled since 2010. 3, heroin abuse is not limited to a certain demographic or geographic area. Let's talk about that. That's why we have to talk about this, because heroin doesn't discriminate. It doesn't matter what demographic background, doesn't matter what culture, what age, what race, what economic background. This has no boundaries. It's just something that will consume you and take you away. So that's why this is so important, that we talk about this, we talk about it in the schools, we talk about it within our families. We have to understand that just because you send your kids down in the basement, that's not solving the problem. This isn't an open air market here. Things happen in your homes. They happen when you're not looking. So you have to be prepared. Next. Heroin abuse is on the rise amongst younger Americans who see it as a cheaper alternative to opiate-based pain abuse. And that's what it's all about. We're here because we're seeing young people die. We have to stop it. Between 2002 and 2013, the rate of heroin-related overdose deaths nearly quadrupled. And we're seeing that. And lastly, that's my last bullet, but over the weekend, Virginia collected 31,000 pounds of prescription drugs during our take-back program. That program, we cut that program 2 years ago, but with the effort of the governor's task force, which I serve on, we were able to bring that program back on a national scale. So that's why this is so important. And this is why I'm glad you're here today, so that you can understand and we can educate you. Thank you.
Thank you very much, Carl, for all you're doing and the DA's doing. Next up, we have, kind of to bring it down from the national regional level to the local level, is Lieutenant Cox of the Fairfax County Police Department. I also want to recognize the Chief of Police, Ed Rossler, who's here, and he's committed to addressing these issues in this crisis. It's no accident we're the safest jurisdiction of our size in the country, and it's because of the great people we have like Lieutenant Cox and Chief Rossler. Lieutenant Cox is in charge of the Fairfax County Special Investigations and Narcotics Squad. No one knows more about the problems we're seeing in the county than Lieutenant Cox. You're going to hear more from him